Hi everybody, my name is Dr. Uri Burstyn and this is Mr. Pirate the Cat, and today we'll be talking about how to manage osteoarthritis in cats. Before we get into that, I'd first like to clarify what I mean by arthritis, and I'm going to invite you guys to watch the series that I have on how to take care of older cats, because a lot of the tips are actually aimed at improving the quality of life of cats with osteoarthritis. So if you look at the series of 3 videos that I have on how to care for an older cat, all of those tips can be really useful for your little feline if they have a diagnosis of arthritis. What I mean specifically when I talk about arthritis in this context is osteoarthritis or degenerative joint disease, which is the age-related variety. As many of you probably know, our bones have a coating of cartilage on the ends where they meet, the space called the joint. And that cartilage acts like a little lubricating coating on the ends of the bones that lets them glide past each other. Think of it like the Teflon coating on a frying pan. It's there to make everything smooth. And what happens with age and wear is that that coating can get chipped, it can get eroded, it can get flaky and kind of dry, and in the end it can get worn away. And that process is degenerative joint disease, osteoarthritis, or just arthritis. And what happens when you have an erosion of this cartilaginous covering on the ends of the bones is bones start to grind on each other, which is very painful. And of course, just the process of erosion causes inflammation inside the joint, which is also painful and also reduces the mobility within the joint and reduces its sensitivity within the joint, all of which contributes to what we see with arthritis, which is joint pain, lameness, limping, stiffness, and just generalized discomfort. So that's what arthritis is in the context of the kind of age-related degenerative joint changes that we're currently discussing. So, how do you know that your cat has arthritis? Well, I do have a video on how to diagnose arthritis in cats, or some signs that your cat may have arthritis. Again, please check it out, link in the description below. And once you've watched that video and followed the process and have a diagnosis of arthritis in your little senior cat, let's talk about strategies for managing it. So the first one, probably the biggest one and probably the most boring one, is weight management. Obesity is a huge contributing factor to mobility issues and makes all orthopedic problems worse, and losing weight makes all orthopedic problems better. So the first step, if you're worried about mobility and discomfort and osteoarthritis in your cat, is get them to a healthy body weight. And weight loss in cats is a whole different topic that probably warrants its own series of videos. And there's a couple of tools out there that certainly make it a lot more feasible. You know, cats losing weight is very, very challenging to do unless you have really, really clued into what you're doing. But having a cat be a healthy body weight is absolutely the best thing you can do for them if they have arthritis, because it just makes life with arthritis so much easier. And it can also make all the other stuff I talk about not necessary. It is not uncommon for patients who really need like a lot of pain control, a lot of interventions to be comfortable, to lose some weight, and all of a sudden they no longer need drugs to be happy. They can just have nice mobility and nice quality of life without any pharmacologic interventions. So weight control and avoiding obesity, super, super important. Kind of trite advice, but cannot be said often enough. The other side of it is, of course, exercise and maintaining muscle tone. That's kind of a moot point in cats. You can't make a cat exercise. So we're not going to spend too much time talking about that, except to say that the only way to really promote activity in an arthritic cat is to give them effective pain control, which brings us to our next point. Pain control is the mainstay of managing arthritis in all species. You know, like in humans, you have arthritis, you take ibuprofen. Of course, that's a type of drug called a non-steroidal anti-inflammatory, and it's really great for arthritis because it reduces inflammation in joints and is also a painkiller. Now, first of all, I want to say never, ever, ever, ever use human non-steroidal anti-inflammatories in animals. They're all quite toxic, but there are classes of non-steroidal anti-inflammatories that are okay to use in cats and dogs, specifically designed for them, and they have a good safety profile. The most common drug in this class is Metacam, that probably most pet owners are familiar with. And it is very, very effective at managing arthritis. Now, I know that in the United States, there's all sorts of black label warnings, very scary stuff put out there about how using Medicam in cats can damage their kidneys. And fair enough, any drug of this class can damage the kidneys if used inappropriately. For this reason, nonsteroidals are rarely used in cats to manage arthritis. And even though I don't like to panic about this sort of thing, I definitely am very selective about which cats I use nonsteroidals in long term, and I do tend to do so very infrequently. There is at least one study out there showing that if you give Medicam to cats long term, it does not lead to a progression of kidney disease. It was quite an elegant study. They gave Medicam to both elderly cats without kidney disease and elderly cats with stage 1 or 2 kidney disease for, I think, about 2 years, and they showed no progression in kidney disease, but it was given at lower doses than normally recommended. But despite the present study, which does make me feel a bit more comfortable using it, it is definitely not a mainstay of arthritis management in felines, though perhaps we should give it a second look. The other option for pain control in cats, or the other options, include medications like gabapentin and buprenorphine, which are extremely safe even in patients with kidney disease. But the problem with basically any painkiller that's not a nonsteroidal is that the side effect, the primary side effect, is sedation, which isn't that bad. Really, having a sedated cat is better than having a cat in pain. But the challenge there is that if we are trying to monitor response to treatment, or giving a medication to a cat because their joints are sore, and we want to know if it's working, we want them to become more active. And that's generally speaking what we see. We have a patient in pain, we give them a painkiller, and become more active. We know that the medication is working. But of course, when the side effect is sedation, what we might find is we have a cat who's sleepier and less active. And while in theory, it's better to have a cat who's less active because they're doped up on morphine rather than because they're in pain, in practice, it's just not very nice having your cat completely zonked out of it 23 hours a day. So there's definitely a bit of a challenge there, finding the right dose of buprenorphine or gabapentin to help a cat live a nice life with arthritis. And certainly some cats with more severe changes might really benefit from these drugs, but it does take a fair bit of fine-tuning and finding the right dose for your feline. It can be a little bit hard to use. So what you should be getting from this discussion so far is that there's really not a lot of really good drug choices for managing arthritis in cats. They all have significant drawbacks. The nonsteroidals might injure their kidneys unless you're very, very vigilant about how you use them. And gabapentin and buprenorphine might make the cat less active than they were before, even though they might be more comfortable, which is, again, not terribly desirable. So what do you do if you have a cat with arthritis? Well, like I said earlier in the video, look at my videos on making life better for senior cats. All of those suggestions, from heated blankets to padded beds to elevated feeding, are all designed to help cats with neck and elbow arthritis deal with life a little bit better. So lifestyle changes have traditionally been the mainstay of helping arthritic cats live a better life. I should probably give honorable mention to supplements as things that definitely do not work. I know there's a lot of talk out there. I know there's a lot of talk and marketing out there about glucosamine and green lip mussel and all these other supplements. They're supposed to be good for joint health. They're extensively used in dogs and humans, but the evidence just isn't there. None of those things actually make a difference to arthritic patients. They don't really work. They are not widely used in cats because, it's pretty hard to convince people to give cats oral medication even when it is really useful. But unfortunately, none of those supplements really do any good. And the studies there's really excellent, broad-based meta-analyses done in humans with reviewing a number of studies on the topic, and they never really find a beneficial effect to using these supplements on joint health. So unfortunately, that's just not really a useful avenue to explore. Fortunately, there's been one exciting new development in the management of osteoarthritis. That's a new drug class based around injecting monoclonal antibodies that actually bind pain receptors in the joints and basically make patients with arthritis super comfortable. In cats, this class of drug, or the representative of this class of drug, is called Cenia, and it's really taken the feline medicine world by storm, because for the first time, we have an effective intervention that is safe and easily administered that makes these cats a lot more comfortable. So all of a sudden, veterinarians are diagnosing a lot more arthritis in cats than they used to. And it's an injection once a month. And while there's potential for side effects with this class of drug, I just want to remind you guys that any tool that has potential for benefit also has potential for side effects. There is no medication that is beneficial to patients without some side effect risks. And the risks of side effects for Cenia are low, and the side effects are really negligible. So my advice is to use Cenia early and use it often because it will make life better for a lot of senior felines out there. And Pirate, who's valiantly trying to escape this shot because he's a cat and cats are contrary by nature, has definitely benefited tremendously from Cenia. He's got very severe arthritis among a number of other issues that those of you who watch Mr. Pirate Health Updates are probably aware of. And it's just been absolutely night and day for him. So please don't let rumors of side effects stop you from using this amazing tool for managing arthritis in cats. It is effective. It is as safe as anything else we do in medicine. And it's just a really exciting new option for helping these cats live a better and pain-free life. So a huge fan of Cenia right here, and a huge beneficiary of Cenia right here. One other thing that I'm going to tell you guys about that really helps cats deal with osteoarthritis, and you might have been watching me doing it all throughout this video, is massage. Giving cats a little bit of a massage, warming up those muscles, really, really helps them deal with joint pain, just like it does for any other species. And in cats are particularly amenable to getting massage for long periods of time. I actually have a video on how to give a cat a back massage that you guys should definitely check out. Link in the comments below. And I'm doing it right now. And in fact, I even massage Pirate's forelimbs because he does have arthritis in his elbows. So what I'll do is I'll gently massage his tricep, just holding it between my fingers like this, and just like a gentle pinching motion. You see, he's kind of paying attention to what I'm doing. If he was trying to bite me, I would take that as him saying, hey, that's a little bit too much. But he just gave me a little lick. He's kind of noticing it. And usually, I find that he responds really nicely to this. Now, we're shooting this video in the afternoon where he's all warmed up and mobile. But I find that in the mornings when I massage his little arms like this, his gait dramatically improves even after just a few minutes of gentle, gentle massage. And like with anything else related to massage or physiotherapy, if it's uncomfortable for your patient, don't do it. But gentle massage, I find really, really helps mobilize cat joints and really helps him deal with the discomfort osteoarthritis. And actually you can see how he just suddenly relaxed into his side. And that's probably just because it feels kind of nice to have me rub his little triceps here and relax that joint. So that's how you help a cat with osteoarthritis. Thank you very much for watching. Thank you very much for your cooperation, Mr. Pirate. Using the feline definition of cooperation, of course. And I hope everybody has a really nice day. Please remember to squish that subscribe button and hit the bell notification icon so we can see more of each other. And don't forget to like and subscribe and share this video with anybody you think might find it useful. And if you want to support our public education work, then please head over to Patreon, where your support is much appreciated. And I also offer second opinion cases if you need my help with your own pet's medical issues.